The United States spends an astonishing $13,000 per person annually on healthcare. This figure dwarfs the spending of every other developed nation, often double or even triple what countries like Canada, the UK, or Germany allocate. Yet, despite this colossal investment, millions of Americans face a brutal reality. They cannot afford life-saving care. How can a nation so rich, so advanced, allow its citizens to suffer such a profound injustice? This isn't just an economic problem, it's a moral crisis demanding our immediate attention. Today, we confront the stark truth. America's healthcare system is widely considered the worst among developed nations. It's a system where access to health is not a right, but a privilege, often dictated by wealth and employment status. This fundamental flaw leaves countless families vulnerable, pushing them to the brink of financial ruin or forcing them to forego essential medical treatment. We must understand the depth of this crisis to truly advocate for change. The core of the U.S. healthcare system is fundamentally broken, operating on principles that prioritize profit over people. High costs are merely the most visible symptom of a deeper, systemic illness. Millions of Americans are either uninsured, facing catastrophic bills for routine care, or underinsured, discovering their policies offer little protection when they need it most. This precarious situation creates a constant undercurrent of anxiety for families across the nation. Access to quality care in America is tragically dependent not on medical need, but on one's ability to pay. This creates a two-tiered system where the wealthy receive world-class treatment, while others are left to navigate a labyrinth of limited options or simply go without. This disparity is not just unfair, it's a profound betrayal of the promise of a healthy society. It's a reality that healthcare workers witness daily, often feeling helpless to bridge the gap. Moreover, the burden of this broken system is not shared equally. Deep-seated racial, social, and economic disparities mean that marginalized communities bear the brunt of its failures. People of color, low-income families, and rural populations often face insurmountable barriers to care, experiencing worse health outcomes and shorter life expectancies. This systemic inequality is a stain on our national conscience, demanding urgent and equitable solutions. For students entering healthcare fields, understanding these systemic inequities is paramount. You are the future, and your advocacy will be crucial in dismantling these barriers. For policymakers, these disparities represent a critical failure of public policy, requiring bold and compassionate legislative action. We cannot stand by while entire communities are left behind. Consider the devastating weight of medical debt, a uniquely American phenomenon that traps millions in a cycle of financial despair. More than 100 million Americans currently owe money for healthcare, a staggering figure that highlights the system's inherent cruelty. This isn't just about unpaid bills, it's about shattered dreams, foreclosed homes, and families pushed into poverty. Families are routinely forced to make impossible choices, pay for life-saving treatment, or keep a roof over their heads. This agonizing dilemma is a direct consequence of a system that treats healthcare as a commodity rather than a human right. No one should ever have to choose between their health and their financial stability. This is an urgent call to action for every citizen, every policymaker, and every healthcare professional. Insurance companies, ostensibly designed to protect patients, often do the opposite. They frequently deny legitimate claims, raise premiums exorbitantly, and create endless bureaucratic red tape that exhausts and frustrates those already suffering. Their primary allegiance often appears to be to their shareholders, not to the well-being of their policyholders. This profit-driven model fundamentally undermines the very purpose of health insurance. This relentless pursuit of profit permeates every level of the healthcare industry. Pharmaceutical companies charge exorbitant prices for life-saving medications, often far higher than in other developed nations. Hospitals, even non-profit ones, engage in aggressive billing practices, turning medical emergencies into financial catastrophes. The result is a system where corporate profits consistently take precedence over human lives and public health. Healthcare workers, on the front lines, often feel the moral injury of this system. They witness firsthand the suffering caused by financial barriers, the denial of necessary care, and the administrative burdens that detract from patient well-being. Their voices are critical in advocating for a system that supports both patients and providers. We must listen to their experiences and empower them to drive change. This profit-first approach is not sustainable, nor is it ethical. It creates a constant state of anxiety for the general public who live in fear of illness or injury. It's a system that actively harms the very people it claims to serve, eroding trust and fostering deep resentment. We must demand accountability and advocate for a fundamental shift in priorities, placing human health above corporate gain. Let us not forget the human faces behind these statistics. Take the heart-wrenching story of Sarah, a young mother diagnosed with an aggressive form of cancer. Even with what she believed was comprehensive insurance, her out-of-pocket costs quickly soared to tens of thousands of dollars. The deductibles, copays, and uncovered treatments became an insurmountable financial mountain. Sarah, already battling for her life, was forced to start a GoFundMe campaign just to pay for her chemotherapy and radiation. Her story, tragically, is not an isolated incident. It is a common narrative echoing across America. Families are routinely forced to beg for donations, sell their possessions, or declare bankruptcy simply to access the care they desperately need to survive. This is an unacceptable reality in the wealthiest nation on earth. These stories highlight the profound moral failure of America's healthcare system. It fails the very people it is supposed to protect, leaving them vulnerable, impoverished, and often without hope. It's a system that punishes illness and injury, turning personal tragedy into financial catastrophe. This is not just inefficient, it is inhumane. For healthcare workers, these are the patients they see every day, the ones they fight for, often against the very system they operate within. Their empathy and dedication are often stretched to their limits by the systemic barriers their patients face. For students, these stories should ignite a passion for advocacy and reform, inspiring you to build a better future for healthcare. Policymakers must hear these stories, not as anecdotes, but as urgent calls for systemic change. These are not isolated incidents of bad luck. They are direct consequences of policy choices that prioritize market forces over human well-being. We must move beyond incremental adjustments and demand comprehensive reform that guarantees healthcare as a right, not a privilege. The emotional toll on individuals and families is immeasurable. The stress of medical debt can impede recovery, exacerbate existing conditions, and lead to mental health crises. This cycle of illness and financial ruin is a national tragedy that we can no longer ignore. The time for action is now. The urgency cannot be overstated. The American healthcare system is undeniably expensive, profoundly unequal, and utterly unsustainable. Without serious, fundamental reform, millions more will continue to suffer under its crushing weight, their lives and livelihoods jeopardized by illness. It is not merely broken, it is a system in profound crisis, demanding our collective and immediate attention. We must recognize this as a moral imperative. This crisis affects us all, directly or indirectly. It impacts our economy, our productivity, and the very fabric of our society. It erodes trust, fosters despair, and undermines the promise of a healthy, prosperous nation. We cannot afford to be complacent any longer. The time for incremental changes is over. We need bold, transformative solutions. What do you believe is the single biggest problem with America's healthcare system, and what specific steps do you think we must take to fix it? Share your thoughts, your experiences, and your solutions in the comments below. Your voice is crucial in shaping this vital discussion. For policymakers, we urge you to listen to your constituents, engage with healthcare professionals, and prioritize comprehensive reform that guarantees universal access and affordability. For healthcare workers, continue to advocate for your patients and for a system that supports your vital work. For students, educate yourselves, challenge the status quo, and prepare to lead the charge for a more equitable future. Let's transform awareness into action, discussion into advocacy, and education into lasting change. Together, we can build a healthcare system that truly serves all Americans, ensuring health and dignity for every single person. Don't miss our next video, where we explore how innovative solutions, including AI and technology, could reshape the future of medicine, but only if we first fix the foundational inequities. Subscribe, share, and join us in demanding a healthier, more just America.